Have you been stressed, anxious, or worried? Have you felt pangs of loneliness in recent times? Are you longing for greater connection with others in the world around you? In a phrase, are you looking for happiness? You are not alone. Millions of others are seeking this feeling of spiritual, mental, and physical wellness too. This podcast explores the underlying causes of unhappiness and shares with us the secrets of rewriting the frequent thoughts and redirecting the common behaviors that keep us in that state. Join forensic psychologist and best-selling author Dr. Neehall and her guests as they dive deep in the realm of psychological wellness and explore ways of finding happiness on demand.
Welcome, everyone. Today we're going to talk about aerophobia, or fear of flying. Have you ever been afflicted with a fear that leaves you crippled with self-doubt, that stops you from doing what you want to do? It's happened to lots of people. And today, welcome to what I call Fearless Flight, where I'm going to explore the fascinating world of aerophobia, or a fear of flying, through the lens of history, cultural differences, clinical interventions, and the latest research in the area. I'm Dr. Joan Neehall, and we're going to uncover how phobias have been understood over time. I'm going to share clinical examples of overcoming a fear of flying, or aerophobia, and I want to discuss the rising prevalence of this fear and highlight effective psychological treatments that are backed by science. What's the history of phobias? Phobias have been documented since ancient times, with Hippocrates describing irrational fears as early as 400 BC. Did you know that? During the Renaissance, phobias were often seen as spiritual afflictions. Then, in the 19th century, the term phobia became a clinical diagnosis in my field, with Freud attributing phobias to unconscious conflicts. Now, modern psychology, shaped by pioneers like Watson and Skinner, view phobias as learned responses reinforced by negative experiences, including a fear of flying, which is what I want to talk about. Now, let's turn the lenses on some cultural differences in aerophobia. Cultural perceptions of aerophobia vary globally. In Western societies, we often link fear of flying to control issues and cognitive distortions, leading to a higher likelihood of seeking therapy. In Asian cultures, however, social stigma around mental health may prevent open discussions about flight anxiety. Now, Middle Eastern travelers may experience heightened fear, obviously due to geopolitical concerns, while collectivist societies, such as in Latin America, for instance, often associate aerophobia with separation anxiety from family. Because, over there in the culture, family is so very important, including the extended family. Now, let's understand aerophobia from my perspective, or from the psychological origins, and also the rising prevalence. Aerophobia often stems from past traumatic experiences. That's what I've found as a clinician in my field. It stems from a fear of losing control, or it could be genetically a genetic predisposition, if you will, to anxiety. As some people say to me, Joan, it's in my blood. Now, the brain's amygdala triggers intense, really, really intense fear responses. Recent studies highlight a rise in aerophobia post-COVID-19, and that's been attributed to prolonged isolation, reduced travel. Remember, we were restricted to our homes, and increased anxiety about health and safety. We'd be in a very confined environment. Surveys indicate that aerophobia has increased by 12% since 2020, with 8% of adults now reporting significant flight anxiety. So, what do we do with it as clinicians? Cognitive behavioral therapy is something I really believe in. It really works. It's called CBT. And what I do with CBT is I'll reframe irrational fears and I'll reduce anxiety with my clients. Let me just talk about Emily, a case study of mine. Emily is a frequent business traveler, and she overcame her fear of flying, or what we call severe flight anxiety. Yes, she had tachycardia, rapid heart beating, and everything else, and she couldn't breathe too well. But she overcame it, by the way, through CBT techniques, and it only took 10 sessions. And Alan, by the way, is my podcast host today. So if I say Alan, please understand I'm referring to Mr. Edwards. So, Alan, that only took me 10 sessions, and it was brilliant what she was able to do because, over the years I've followed her, and Emily has said to me, thanks to you, Neehall, and CBT, it's really worked. I said, not me, CBT works. Right? Now, there's something called exposure therapy, which is another clinical intervention we use in psychology. So, listeners, if you are experiencing this fear of flying, I'm just giving you some interventions that you might find of use if you seek psychological help. Now, with exposure therapy, there's gradual exposure, which desensitizes the fear triggers. Here was Alex, who hadn't flown for over 15 years, and he gradually exposed himself to flight-related stimuli and successfully flew after therapy. And he's been able to maintain that, by the way. And it's the maintenance that I'm more interested in. We want to make sure this isn't just a quick fix, but, Alan, something that will last over the years, over a lifetime. Now, there's yet another form of therapy, which we call virtual reality therapy. And in that one, we simulate flights to allow coping practice. So you look at your triggers and you can deal with them. 78% of patients in a VR therapy program reported reduced anxiety after a mere 6 weeks. So that's pretty good, huh? Now, if all else fails, and I shouldn't just say if all else fails, because sometimes medication is important combined with therapy. If medication is used short term for symptom management, remember I was talking about rapid heart beating, constricted chest, tightening in the chest, inability to breathe, you can use medication under the supervision of your family practitioner. And that is used often in conjunction with therapy, with one of the forms of therapy I talked about. Now, what's the research and statistics on fear of flying? Research shows 6.5% of people suffer from clinical fear of flying. Studies reveal that collectivist societies experience more flight anxiety due to familial separation fears, while Western societies report higher therapy engagement. Now, that's an interesting difference. Research data from the Anxiety and Depression Association of America shows a 15% increase reported in aerophobia cases since 2019, COVID-19. And it's linked to global unrest, pandemics, epidemics, and heightened safety concerns. Yeah, so the research shows that there is a rise in this fear of flying, huh? So what are some practical tips that we can use as we conclude? What are some of the practical tips that we can leave you with? Because that's important. You need a takeaway. We all do. From mindfulness techniques to gradual exposure to CBT, overcoming aerophobia is possible. Clinical examples remind us that seeking help often leads to success. So share your journey with us. Subscribe to the podcast to give us more insights, because the fear of flying really diminishes your ability to be happy. And that's what we're more concerned with, is you're increasing your happiness quotient. So if you or someone you know struggles with a fear of flying, or indeed any phobia, consider reaching out to a licensed therapist or exploring virtual reality therapy programs. We have many of those, both in Canada and the United States. Visit resources like the Anxiety and Depression Association website for more information. And above all, share your experiences and tips with us on social media using Fearless Flight Podcast. Yeah, it's a tongue twister that I created today. Fearless Flight Podcast. Try saying that fast. Maybe you'll get a phobia after this. God forbid. But anyway, don't forget to subscribe and leave a review to help others discover useful ways to manage flight anxiety. Now, look, if you need some information, some research, some bibliography, I have a wealth of that. Just contact me on my email, neehall.com, and I'd be happy to share with you some links, some research, some articles that you will find of really significant use. Now, I want to turn the lens on our esteemed guest, Alan Edwards, who is going to act on behalf of you, my listeners, and ask me some questions. Alan, it's all yours.
Well, thank you, Dr. Neehall. Fear of flying, of course, I know people who will not get on an airplane. And I'm wondering what recent events, such as the horrible crash into the Potomac River in Washington, D.C., has on people that have this fear of flying. Are there setbacks for people, such as the airing of the documentary Lockerbie on CNN, where everybody lost their lives through a bombing off Ireland?
That's an excellent point that you're raising. It's brilliant because, yes, social media works for us and against us at the same time. You remember in 1950, we didn't have social media. We did not have that quick access to what's happening in the world. And if it bleeds, it reads. As you know, you've been with CBC, so you know exactly what I'm talking about. Yes, these episodes, these horrible, horrible crashes will affect us. All of us, including myself. I mean, I said a prayer for these people who lost their lives. It was horrible. Or their families that are left bereft because of this. Having said that, there's also American Airlines, and people are saying, I'm not going to fly on American Airlines anymore. So the airline industry takes a beating as well. All of our industries take a beating in the airline industry, right? So what do we do with it? First of all, I say, let's look at it realistically. Let's look at the statistics. How often do we have crashes versus how often do we have successes? Now, you and I both know, I'm sure, the story of this surgeon who did incredible work for over 50 years in his field. But the one day he left one instrument in the patient's belly, that was it for him. People were saying, I'm not going to see that. And that's a true story, by the way, that happened in Canada. And people said, you know what? I'm never going to see that doctor again. Never. So the one bad thing you do, and me as well, by the way, as a psychologist, God forbid, if I do one bad thing, it'll be like swimming with barracuda and hoping you don't get bitten, right? We don't remember the good. We remember, because that's our human response. It's all in our DNA, by the way. Genetically, we're predisposed to look at the negatives. Why? Because of survival instincts. And I mentioned the amygdala, that nice portion of our brain that highlights fear and exaggerates it, right? So we have that. And I mean, I would turn to you as, your work in CBC, you will admit that the news tends to focus on negatives. Wouldn't you agree?
Well, that's what people say, and you're right, because we wouldn't go on the air with a news broadcast saying nothing happened today. And usually we want to put out information to warn people, to allow people to learn lessons. And as a news reporter, which I was for 30 years, I always looked for what the lesson was. And so looking at, as you mentioned, the statistics show that flying is the safest mode of travel there is. You're more likely to die as a pedestrian as you would be as a airline passenger. But for a lot of people, that doesn't matter. The thought of being 2 miles up in the air or a mile up in the air, they're not going to do that under any circumstances. I mean, I'm sure you've encountered people who wouldn't matter what kind of therapy they got, they just will never get on an airplane, period.
Alan, that's a good point, because before the client sees me in therapy, I would ask them to give me some information about A, what the problem is, B, give me some solutions if you have any, and C, what's your motivation to change. Because if you don't have a motivation to change, you're wasting your time and money. I mean, talk is not cheap when you see me or any of my colleagues, so don't waste your money. So you would want to look for motivation, first of all, to change. I mean, that reminds me of a case I had with this hairstylist, and she married a guy this was in Edmonton, Alberta. She married a guy who was of Italian extract, but he refused to fly with her to Rome. And she saved all of her money as a hairstylist. She wasn't making piles of money, but she saved to go to Italy. Who did she take? Her sisters, because the husband refused. He said, no, I'll go with you on a motorbike. Can you now take a load of this? He goes with her on a motorbike from Edmonton all the way to Kamloops. Not a problem. He loves that. That's his idea of adventure. But to get him on a plane, not happening.
Yeah, it's interesting. You won't get me on a motorbike because that's dangerous for me. But maybe I'll see you after the podcast and we can work on that.
Of course, we will not. But never mind. Yeah, it's interesting.
So I'm wondering if this fear of flying is increasing for people or decreasing.
Increasing. That's what I mentioned with the statistics. It is on the increase by at least 12%. And there are many reasons why that's happening. You mentioned a very good one, social media. People are highlighting the negatives. But there are also some concerns after COVID-19. It increased because we're now aware of health issues, of contracting a virus, which we were not aware of before. Do you remember Ward Air? Back in the day, we had, by the way, listeners, this fabulous airline in which going on a plane was considered the best thing possible. You looked forward to it. You dressed up for it because the airline served you your coffee, your meals on fine china. That's gone. Okay, with all of the conflicts we have right now, with safety issues, etc., with warfare, we use plastic right now. So there are many reasons why people would be reluctant to travel now. I mean, who wants to be stuck on a plane when there's a threat of a bomb? I mean, it leaves people feeling very vulnerable.
Well, now there's a threat of measles. Very recently, they put out warnings, particularly here in Vancouver, where I live.
Yes.
Where they're warning people who have been at the airport at a certain time, and a certain date, that they may have come into contact with somebody with measles, and that's highly contagious. And of course, to be stuck on an airplane with people with a disease would certainly increase the fear of flying.
That's such a good point, and it's true. And remember that measles was something we thought, like polio, was a thing of the past. We had gone beyond that with vaccines and everything else. But yes, it has filtered back in, and yes, it is a problem.
So I was on a flight to Shanghai, sandwiched in. It was a full flight. It's a 14-hour flight. And a fellow behind me was an American from Sacramento, Asian fellow, and he coughed and hacked all the way there. And there's nothing I could do about it. And there's nothing anybody could do about it. Of course, I didn't have a mask to put on. And a couple of days later, my knees went out from under me and I got severe flu and really impacted my 2-week trip to China because I was very, very sick during that period of time. And so some of this is legitimate. If you're stuck on a flight with people who are ill and there's nothing anybody can do about it, some of this is legitimate. And I would say, or what would you say as a therapist to somebody who had this fear of being stuck on an airplane with somebody who was sick, and they may well be susceptible to respiratory illnesses?
I think the important thing there to do is to pre-plan. I say to all of my clients with whom I deal with the fear of flying, plan it carefully. Get your mask. Make sure it's one that's certified, and a good mask. Put that on. Make sure that you've got wipes, for instance. I go into the basics, okay? I'm saying the place where most germs live would be on those trays that they tell you pull out to have your meal. I tell them have your hand sanitizer, wipe everything before you even sit on at your designated seat. And I mean everything. I'm including your belts, your safety belts, everything has got to be wiped. Have your N95 mask, put it on. Regardless, I really like what you're saying, because I tell people, I don't care if people seem healthy in front of you as you're sandwiched in the middle, God forbid, put that mask on and keep it on, except at such times as you're eating and drinking, and then put it back on. Those are some very important things that you can do to start off with. Now, obviously, if you're on a plane and someone's hacking, there is that feeling of loss of control, which is going to be heightened if you have no safety precautions. Now, the ones I'm suggesting would help you with airborne diseases. Okay, make sure before you get on the plane, if you're going somewhere that's transatlantic, that you've gone to your travel nurse or whoever you've got to make sure all of your vaccinations are in place, including measles and everything else. So I would talk about precaution before you get on that plane, okay? And having all of your medication there at hand. But it isn't a case of just using Ativan, sublingual Ativan, which is a medication that will calm you down when you're flying, when you have someone, as you said quite appropriately, who is sitting next to you hacking away. Put that mask on and keep it on for dear life. Shanghai is a long flight. I mean, we're talking 12 to 24 hours. And yes, put that mask on, keep it on, even when you're sleeping.
Yeah, I wasn't offered one by the airline, which I think they could have done. I'm in the public relations business now, no longer a television news reporter, as you know. And so I tell my clients, don't use any trigger words such as sickness or need for masks, that kind of thing, if it's not mandated, because then you raise issues that aren't there. But that sort of begs the question, is there more the airlines can be doing to combat this fear of flying?
I think the airlines can perhaps give you masks. They used to, by the way, in the height of COVID-19. I remember being offered one, and I said no because it was not an N95 mask. They can offer you masks, but the problem is money. Do they have enough funds in place to be able to say, okay, we're going to provide N95 masks for everyone? The answer is probably a flat out right, no, because as we both know, the airlines industries have taken a financial beating, okay? So I don't think that they're going to be giving it to us, but I think it's up to us to be proactive as travelers. And you remember we were talking about a loss of control? This is where I tell my clients, you can take control of your life. You can decide these are the things I'm going to do in my personal space. I'm going to get those hand sanitizing masks, and I'm also wipes, pardon me. I'm going to wipe everything down, including the tray, by the way. Most people don't, and I tell, except, well, if you're my client, you'll be able to recognize them because they take those wipes out, they wipe everything. And I remember one of them saying to me, you know, Joan, after that, the guy sitting next to me said to me, are you a germaphobe? And I said, no, but I'll give you a wipe if you want. But, you know, we've got to take responsibility. We can't pass it on to the industry because A, they don't have the funds, and B, what they're going to give us is not medically, it's not quality. And I want quality. I want one N95 mask. How much is that going to burn me? Maybe $5. Okay. In the States, it costs more, by the way, like a COVID-19 test here in the States, it costs money to buy one in the pharmacy, CVS, whereas in Canada, we get it for free, right? So there's a difference in the two places. But I would say in response to your question, let us be proactive. Let us decide what we're doing. But I want to go back to something else that you said that was brilliant. You mentioned terminology. So it reminds me of a case of mine a couple of years ago. This guy said to me, you know, think of the words they use, your final descent. This is the terminal. This is the termination of your flight. He said, listen, Neehall, that scares the blot out of me. I said, what's your language? He said, you know, this is terrible. And I said, I guess I never thought of it that way, but I laughed at him. But I used humor as a way to change it. I said, well, what do you want us to call it? He said, if we say end, isn't that worse? Is that end of life? And so we got into this wonderful discussion, nothing to do with psychology, but at the end of it, he didn't care about the language anymore. See?
Yeah. Well, that's a very good point because words matter and words are triggering for some people. And the thought of this is your final destination, going to the terminal. The terminal is where you're going to end up. These are all triggering words, and they wouldn't add to the comfort of those people who fly. Anything else you'd like to add? This has been so interesting because I personally know people that won't go on an airplane, and I'm sure I know people that have overcome the fear of flying through visits to psychologists like yourself.
I think the important thing to do is to embrace the fact that you are experiencing a phobia. Our society is so shame-oriented, that I don't want to talk about it. This is terrible. Whatever your fear is, it could be fear of spiders, fear of confined spaces. It could be a fear of reptiles. In British Columbia right now, we have an infestation, for example, in Victoria, on Vancouver Island, of water snakes and lizards. And it never used to be like this before, And people are really scared of those things, not because of what they can do, but they just a loss of control. So you deal with those things. You go to a therapist. It doesn't have to be a psychologist. I mean, social workers will do it. We are so blessed to have so many people at our disposal who know how to treat this. I would suggest go seek therapy if you can. Put away the shame, put that on a side burner, and go and deal with it. Because you know what you're doing? You are robbing yourself of the best life possible. You're cheating yourself. Don't we all deserve to have a good life?
We do. And what I've learned from you is you can change your own channel, you can change your own life. And for some people, not flying is not an option. My work, of course, as a television news reporter, I was in all kinds of airplanes. And if I had a fear of flying, I wouldn't be able to do that job. So for some people, it's not an option to say, well, I won't get on an airplane or I have a fear of flying. So thanks for tuning into this podcast. And please subscribe to this podcast and learn more tips from Dr. Neehall. And she can be reached at neehall.com. And again, thanks for tuning in, and we'll see you next time. Bye for now.
Bye, Alan. Thank you so much.
Thank you for joining this discussion on happiness. We hope this helps to inspire you to lead a more joyful life. To dive deeper into the subject of happiness, be sure to check out Dr. Neehall's book, Happy is the New Healthy, available as an ebook or hardcover. For additional resources, visit our website at drneehall.com. Until next time, stay happy.